Wonderful. Wow, this is a big room and lots of people. Excellent. Thank you so much. I guess that means there's a lot of interest in this topic, which is fantastic. We also have a very nice panel with 4 excellent speakers. So I think we are in for a treat. My name is Tanja Sejersen. I did a bit of presentation yesterday, but I lead the CRVS work at SCAP, or Asia and the Pacific, which means that I know a lot about Asia Pacific, but very little about the other regions. So I really look forward to also hearing some of the examples from Africa. That'll be very nice. The topic of our session here is on CRVS systems assessments, coordination and digitalization, and interministerial interagency coordination. And I think we've heard a lot about problems with coordination over the last few days already. I think this is never going to go away. In Asia and the Pacific, the way we kind of try and support coordination is that we have a formal regional steering group for the whole region. We also have a partnership of all the development organizations at the regional level that try and meet regularly to try and coordinate activities and help each other. And then all of the countries in Asia Pacific have basically set up CRVS coordination mechanisms at the national level to try and coordinate activities at the national level. And of course, in some places that works fantastically, and in others it works a little bit less well. And I'm hoping that we can get some lessons today about how it potentially could work better. But we are running short of time, so I won't speak too much. I'm hoping that we can finish by 1:30. So that brings us down to an hour from the original 90 minutes. So please, for the kind speakers, try and stick to time. The very first presentation we have is from Indonesia. We already heard from Indonesia a few times, and now we're hearing from Indonesia again, which is fantastic. The presentation is on interagency coordination in support of integration of civil registration data as part of Indonesia's combined census and One Data initiative. And I'm very pleased that we have Vinita to speak. Vinita is with the Statistics Office of Indonesia. And she is an excellent speaker, so we're in for a treat. So could we get Vinita's presentation up? It's already there. Over to you, Vinita.
No. Sorry, you cannot see me. So actually I'm very nervous. I'm happy because you cannot see me from there. Yeah, I didn't expect that we will be having this room. So yeah, so forgive me if I'm getting nervous, okay? Thank you, Tanya, for the introduction. So today I will present this interagency coordination in Indonesia. Should I stay next or should I? Oh, okay, yeah. Sorry, you cannot see the title there. I don't know what happened, but yeah, that's the title. This is already mentioned several times. We are a big country with almost 300 million population with 17,000 islands, stretched from like Dakar to Nairobi and so on, and very complicated country. So I just want to emphasize that we are very complex and it's so difficult to, coordinate between complicated people, right? Yeah. However, complex its situation, Indonesia has made significant progress in improving legal identity coverage and vital statistics, although challenges remain. So in 2014, ministers from across Asia and Pacific adopted the ministerial declaration to get everyone in the picture, and Indonesia is proud to be part of this regional commitment, which aims to ensure that all vital events, birth, death, and others are universally registered. Second, all individuals receive legal documentation of these events, enabling them to claim their identity, civil status, and rights. And accurate and timely vital statistics are produced and disseminated. At the beginning of the decade, Indonesia faced substantial gaps. In 2012, about 24 million children under 17 years old had no birth certificate, and less than half of the couples had marriage certificates, and death registration coverage was extremely low, with only 2% of home deaths recorded. These figures underscore the urgency of the CRVS improvement. So, as this show that all the process to register vital events, included many ministerial and bodies in Indonesia, which also complicates the process. And to ensure coordination, the government established the national strategy to accelerating population administration for the development of vital statistics to Presidential Regulation 62/2019. This regulation outlines 5 key policy directions, which you also can see the 5 policy directions. And while progress has been achieved in 4 areas, unfortunately, the key goal number 4, which data provision and quality improvement, have remained challenged as Indonesia near the end of the CRVS decade in 2024. So, as we know that CRVS produced 2 main outputs, legal documents and vital statistics. As we emphasized in yesterday's opening remarks and this morning rapid insights, we cannot manage or improve what we cannot measure. Reliable data is therefore essential to inform policy, planning, and monitoring. However, producing accurate vital statistics in Indonesia remains challenging, and key issues include unclear mechanism for data collection and access, limited access for BPS or statistic office to individual level vital events data, concern over data quality, insufficient skills for statistical analysis and report production, and limited governance budget allocation. To address these challenges, a more technical regulation was issued by the Ministry of National Planning, establishing a vital statistic production team chaired by BPS in 2024. So it's like almost the middle of the year. And fortunately, Indonesia has also issued the One Data policy since 2019, which are in line with the effort of to produce vital statistics. The objective of One Data policy is to ensure that government data is accurate, up-to-date, integrated, and accountable, strengthening evidence-based policy making. It follows 4 core principles: data standard, metadata, interoperability, and reference code. This effort is supported by establishing national and subnational coordination forum, which include all government bodies at the national level and subnational level. To further ensure the quality of data produced by government agencies, sectoral statistics assessment, or we call it EPSS, has been conducted since 2023. This program is issued to evaluate statistics implementation across central and local government, producing a statistical development index to each government bodies at the national level and at the subnational level. To further ensure the quality of data that produced by government bodies, we recognize that not all agencies have sufficient statistical capacity. Therefore, BPS has also launched a sectoral statistics assistance program in 2024 to provide mentoring and technical support nationwide, in national level and also in subnational level. Through close collaboration with the key ministries nationally, and with strong support from ESCAP, UNFPA, Vital Strategies, Puskapa, and WHO, Indonesia successfully produced its first CRVS and inequality assessment report in 2024. Within just 6 months, this was made possible thanks to technical guidance, training, and coordination support from our development partners, particularly given the limited domestic funding for coordination and report production. So I will just go back here that this shows that nearly 90% of Indonesian population has been assigned a unique identification number. Even though it's only about 1%, it's still living around 4 million people without legal identity. This is still work to do. And, but this also marks a major milestone toward universal coverage, though effort must continue to reach the remaining population. So this is the brief result of the CRVS vital statistics results. There were only 37 of babies are registered within the statutory period, which is 60 days after the birth, and only 55% before the age of 1. And birth registration become nearly completed by age 5, when children will start to go to school, and around 50% of deaths are registered within 5 years of occurrence. And interestingly, the death registration increased notably during the COVID-19 pandemic, reflecting improved awareness and digital accessibility. Unfortunately, it wasn't continue until now, so it's back to the previous situation again. So, realizing that Indonesia has not reached the initial CRVS decade commitment, leaving many gaps. By the end of 2024, this become the reflection of the governments. And Indonesia still took part to the ministerial declaration on the extension of the Asia-Pacific CRVS decade 2025-2030. However, the legal framework for interagency coordination under presidential regulation has expired in 2024. But given the intensive coordination the last few years, a new regulation is being prepared with the coordination with all ministries included in the last presidential regulation. Through strong collaboration, relevant ministries have been working intensively on the draft, with BPS designated as the initiator of the submission. The draft was submitted in last August, and is scheduled for inclusion in the 2026 regulatory program. So this is the CRVS framework that we proposed within the new regulation. Maybe you cannot see the detail. I don't want to talk in detail, but it shows that with this new framework, we propose that clearer guidance on the notification flow and data transfer mechanism for the production of vital statistics, strengthening interoperability between civil registration, health, and statistical system. And this is also the newly program instructed by our president, which also related to the initiative. So this is the Unified Socioeconomic Database, which will be the main source for the social assistance data in Indonesia. So the data are integrating all the social assistance program integrated with population registration, and this could be the future opportunity also to produce vital statistics. So as administrative data quality improves and BPS gains greater access and also has initiated program to assist the ministries, and they also launched the program to evaluate the statistics capacity in all government bodies, we hope that we will have improved census in the future by utilizing the administrative data for the census. Actually, we have been used the population register in the last census in 2020, but the usability has still limited for the pre-listing and verification of key demographics. And in 2030, we aim to enhance the quality and usability of administrative data for censuses and statistical production. One last one. So to conclude, Indonesia's journey offers several lessons. Strengthening CRVS requires strong and sustained interagency collaboration. Producing reliable vital statistics depend on access and data quality, yet formal agreement between ministries often take time. With limited government funding, donor support remains crucial to facilitate collaboration and capacity building. Training and exposure to global practices enhance both technical skills and awareness of CRVS importance. The One Data policy and sectoral statistic assessments serve as key instruments to improve data governance and integration. Finally, BPS continues to support ministries and local governments through ongoing technical assistance to ensure data of high quality is available for development planning and monitoring. Thank you.
Thank you so much, Vinita. And I think it's really inspirational. I mean, this is the fourth biggest country in the world, right? And they have managed to do so much in such a short period of time. And you managed to coordinate like 22 ministries and also being very good at clarifying your needs to development partners. So it was a really good presentation. Thank you so much, Vinita. Yeah, another round of applause for Vinita. Thank you. And then I also have a little other thing I want to mention. We have actually had an addition to the program that you saw in your, that's on the website, which is fantastic. So we will have an extra presentation, and we're really lucky because it will be from Kenya, our host country. And we will have Mr. Paul Wanangemi to present, and he's the head of civil registration services in Kenya, so we're very lucky to have him here. So if I could ask you to join us on stage, that would be wonderful. Thank you so much, and my apologies, it was not on the website. I'm not responsible for the website, but I apologize anyway. Thank you so much. So if you could sit here, that'd be great. Thank you. Okay, fantastic. Okay, so that was our first presentation, and I hope you took good notes. I did myself. The next presentation is looking at how business process mapping has been used in different countries and also for digitalization of systems. I know this is an issue that's really important for many of you. And to do this presentation, we have Subhashri Dash, who is with Vital Strategies. You want to join me up here, Subhashri? Thank you. There you go. You might need to move the microphone as well.
Yeah, I mean, okay. 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 Hi, everyone. Am I visible? Okay. Okay, hi everyone. I am Subhashri. I'm from Vital Strategies. So I'll be presenting lessons we have learned till now from different countries, from Africa, Asia, and Latin America. I'll be focusing on countries we are supporting in the region. So let me figure out how to use laptop and the remote. It's not. Maybe it's fine. It's. Yeah, it's going. Okay. Okay, great. Okay, so Vital Strategies is currently supporting 18 focus countries through the Data for Health initiative in Africa, Asia, and Latin America. But beyond these, we have also supported many other countries globally from 2015, as you can see in this map. Okay, so I won't go into theory like what is business process map, how do we map business process, how do we draw a business process, because that is very theoretical and I think many of you already aware about. But just to give you an idea, so business process is a chain of events, activities, and decisions logically accomplished to produce vital statistics and design the civil registration process. This is an example of a business process map where you can see different actors. I mean, there are separate swim lanes. You can see civil registration office, district registration office, village head. So there are different actors. They have different roles and activities. So this helps us to identify the bottlenecks and also to design the new process, I mean the redesign process. Okay, so this is one of the examples of the course CRVS business process. So there is a trigger, like when there is a birth occurred. So it depends, I mean, what your country wants to achieve. For example, it's a certification and timely registration of birth occurring at hospital. So occurrence of birth will be the trigger. Then there will be process flow, and I mean how the information is going through from hospital to the registration center and how the registration is being done and certificate is printed. And as you can see, there is process outputs, there is birth certificates and a vital statistics report. From Indonesia, the first vital statistics report. Okay, these are some of the core business processes we are working on. Our more focus is on birth and death registration. We're not currently focusing on marriage and divorce, but we are interested. Maybe in the future, we will definitely work on in this area. So now let's have a fun activity, and I will ask some questions, and you have to raise your hand if you agree. Okay, so the first one, it's very simple. Let's start with, if you ever wished a service could be faster and simpler. Raise your hand. I mean, any service. Any service. Any service. I mean, going from here to the restaurant, maybe going to your room. Okay, great, great. Okay, now raise your hand if you ever had to fill out the same information on more than one form again and again. Yeah? Yeah? I mean, yes, exactly, the same name, mother's name, father's name, birth date, death date, I mean, I don't know how many things. Okay, now this is my favorite. Raise your hand if you ever seen a system get digitized, but it didn't actually make the work easier. Yeah? Yeah? Yeah. See, I know, it feels like, we just took a bad paper process and made it to a bad digital process, right? So if you have raised your hand at least once, congratulations, you have already know where business process improvement can come in and help you, right? So let's dive into how this works in CRVS. So business process improvement is really about making system work better for both people and institution, people as in the client and the institutions. So first, it helps us improve customer services and experiences. So in CRVS, this means people can register events more quickly and with fewer obstacles. Second, it helps us identify bottlenecks in the system and redesign the process to make them more efficient. Third, by removing duplications and unnecessary steps, we can reduce operational cost and save value resources. Okay, oh, sorry. It's, yeah, so interoperability and coordination is missing. Okay, now, another important part is aligning stakeholders. I mean, CRVS often involves multiple ministries and health facilities and, village head, local offices. So BPIs, like business process improvement, actually brings them together, work as a group rather than in silos. Then finally, business process improvement allow us to introduce a re-engineering system or a redesign ideas by leveraging technology. Instead of just digitizing the broken process, we redesign it first and then apply technological solution to make it sustainable. So in short, business process improvement gives us a structured way to improve performance, save resources, and deliver better outcomes for people. Now, we are talking about digitalization, business process improvement. So there are many confusion going on. I mean, when we do business process improvement and when we should go for digitalization, what should come first? So technological solution can revolutionize the way we can work, streamlining workflows, automating repetitive tasks, enabling new ways of thinking. But however, these tools are enablers and not the solutions themselves. So they need a solid foundation to deliver values. So that is why, while designing the process, technological solutions have to be explored from the beginning as part of the improvement process. But before even thinking of implementing the technology, we need to thoroughly define the business process map. Why? because technology can only address the problem we clearly define and identify within a process. If the process itself is flawed or undefined, even a best technology won't deliver results, right? So this is why process clarity is very, very important and critical. Now I'll go to the country examples, like what we have achieved from 2015. And I have tried to compile some of the examples from Africa, then Asia and Latin America. And I will be just, okay, sorry. Okay, so I will be going through the slides, but like for Africa, I am assuming my colleague James is here. If he's not, but if you have any questions, we can like have a clarity later. So I will start with, in Africa, Rwanda has showed us the value of strong governance and legal alignment with clear policies and accountability. They also demonstrated how critical it is to system integration, is especially linking health facilities with CRVS to capture births and deaths in real time. In Kenya, the breakthrough actually came from documenting workflows and redesigning processes. Once the bottlenecks were identified, system could be simplified, making registration more efficient and user-friendly. Ethiopia taught us something very important, the importance of phased implementation approach. I mean, piloting before scaling reduces risk, so allowed adoption and build confidence for national rollout. Then in Tanzania, lessons centered on context, so they developed a hybrid one-stop registration model that worked for country realities, making CRVS services more accessible to all. And in Mozambique, BPI facilitated stakeholders' engagement to design a CRVS system that reflects realities and data use needs. Now this is Asia. So I am supporting Bangladesh, and my colleague Khalid is also present here from Bangladesh. So Bangladesh, there is a Kaliganj model. It's very famous. So the Kaliganj model actually demonstrated a very successful health CR linkage, where community health assistants now collect information of birth and death, and digitally through Smart Health BD, that's the application, and send it to national CRVS system. And while in facilities, the data goes through DHIS2. So the digital and the coordination approach has significantly improved the completeness and timeliness of registration. So I must say Kaliganj has been like a big improvement in Bangladesh, and we have achieved so good results in Bangladesh. Now in Cambodia actually successfully applied the assessment analysis and redesign process, which is the stage 1 of the CRVS framework, and to guide a new CRVS ID law, supporting the health and CRVS digital link. Through this, births, dates, cause of death, even stillbirths are now notified to civil registration, and vital statistics also, showing how BPI can drive legal reform and system innovation. In Sri Lanka, they have actually fully integrated medical legal death investigation data into a national CRVS system through business process re-engineering. In Thailand, they use the CRVS systems improvement framework to bring stakeholders together to identify gaps and develop a strategic and action plan for mortality data improvement. In Vietnam, recently they have completed a pilot where they have digitized the death reporting at the commune level. So the data entered into the DHIS2 automatically and linked to the electronic CR database via API. So this is like a real-time integration and allows registrars to follow up unregistered deaths daily, achieving more timely and complete death registration. From Latin America, I just got one example from Bolivia, though we are supporting Paraguay and other countries. So in Bolivia, through the business process improvement, they have established a national CRVS and technical coordination task force, bringing all together. And then they have already supported the vital statistics reporting, which has improved through better data quality, disaggregation, and continuous process improvement. Resources were mobilized to fill out civil registration office positions. Again, in Cambodia also, they are doing the same. They are trying to help the civil registrar's office to make them more independent and more resourceful. Also, service provisions has advanced with wider CWA 2.0 coverage, to secure medical certificate issuance using digital safeguards. And finally, quality and monitoring has been enhanced by strengthening cause of death reporting, reducing unidentified deaths, and introducing automated coding for greater accuracy and efficiency. So these are some examples from different regions. I know it's too much, it's difficult to understand, but yeah, I was asked to present, so I tried to compile all this. So with this, I'm done with my presentation. Thank you so much.
Thank you so much, Subhashri. That was a very rich presentation, and maybe some of you can recognize your own country in that as well. Sorry, one sec. Thank you so much. But I like how you also, I mean, we presented on the CRVS improvement framework yesterday. It's nice to see some of the results it's had in countries as well. So thank you so much for that, Subhashri. The next presentation is from a colleague from WHO. It is on insights on alignment and coordination from the partner mapping tool and related initiatives of the Health Data Collaborative. And the Health Data Collaborative is also is a global collaborative that also tries to help coordinate things. So we have Mr. Leonard Cosmas, who is a technical officer, Health Information, Digital Health and Innovation in the Kenya country office. So we're going to hear from you first, and then afterwards we're going to hear from the Civil Registry of Kenya. So over to you. Thank you.
So while they're uploading the presentation, I apologize in advance. That looks like we were selected as a very group of short panelists. So at least you can see our heads. So my name is Leonard Cosmas, as has been mentioned. I'll be presenting on country partner mapping tool, a tool developed by WHO, and I'm doing this presentation on behalf of my colleagues at the WHO headquarters who are not able to come and join us for this very great symposium. As she's mentioned, the Health Data Collaborative is a global initiative coordinated by WHO, and the main mission of this particular initiative is to promote partner alignment and also bringing partners together in terms of proper coordination in various areas of health information system strengthening. We've noticed for a long time that there's a lot of fragmentation and coordination in this space. And so working with over 400 partner organizations and over 1,000 member stakeholders, this collaborative aims to bring all these partners together, as I've mentioned, to strengthen the national health information systems through improving coordination among the partners and the alignment in terms of a common goal on the delivery in terms of strengthening the health information systems where CRVS falls in. So this country partner mapping tool is one of the tools that has been developed through this Health Data Collaborative to be able to address the challenges of fragmentation and coordination that we have witnessed. And it came as a request from a number of countries that are member states to WHO and a number of partners to work together with under WHO's leadership in terms of developing a tool that will assist in helping partners align in terms of our support to the countries. And also you realize that even from the presentations we've had, fragmentations is one of the key challenges that we encounter in this space. And so a proper coordination mechanism, even at the country level, but even beyond, is quite so very, very critical. And so the tool that I'm going to present about is a web-based tool that has been developed to be able to help bridge these gaps in terms of addressing the overlaps in our various areas of support, but also helping us to align in terms of how do we better support our member states. So as I've mentioned, it's based on a request that we received from a number of countries. And so the tool has been tested in a few countries. Within the Africa region, we've had a number of countries like Kenya having used this tool to be able to map partners that are supporting various health information systems, including CRVS. One observation we've made, especially like say in the area of CRVS, is in as much as we have many partners, if there's no proper coordination mechanism even at the country level, it becomes quite so very difficult to understand who is supporting what element of CRVS. For example, the coordination required, and which has been already demonstrated in this symposium about the three main institutions, that is the Ministry of Health, the Civil Registration Services, and the National Statistical Offices, is quite so very critical. And you find a number of us as partners probably aligned to specific areas. There are those of us who probably support only the component of births, others support the components of deaths, others support the component of cause of death, others support components related to marriages and divorces. So if we do not get to understand how our collective contribution is leading to the strengthening of national civil registration systems, it really becomes quite a bit of a challenge. So in Kenya, and among other countries where this tool has been used, it has helped us map partners who are supporting various components of the national health information, with the inclusion of also the CRVS. In Tanzania, the tool was also used to be able to align partner activities within the national health information priorities, while in Malawi, we also used the same tool to map and visualize partners' contributions, because we understand, again, that partners, in our terms of our technical and financial support, some would be providing some seed funding, others primarily providing technical support. So getting to know the capabilities and the opportunities that exist within the framework of partnership is quite so very critical. The same applies to this tool being applied in DRC, where we also saw that the tool assisted with a lot of guiding on coordination among donors and implement partners who are working on the health data space. So the tool is basically building on what we presented yesterday on the SCORE assessment. The SCORE assessment, as was presented yesterday, is a global tool also developed by WHO, which supports countries in assessing various components of the health information system. And the CRVS, where the C for counts come in, is one of the core components that the assessment also is anchored on. So for this particular tool that we have developed, it is broad in scope, building on the gaps that we've identified in the SCORE assessment tool, and working with our member states within all regions of WHO, but not necessarily within the Africa region. As you can see, I'm not sure you can be able to read on this side. The tool has been tested in a number of countries, and one of the countries is Sri Lanka. Sri Lanka adopted the tool to support them in coordination mechanism of partners who are supporting work around health data, health information systems, and also digital health. And that also includes the CRVS. And so through this engagement and the adoption of the tool, it basically supported the government to be able to align in terms of having coordinated communication to the partners, and also as well as clearly understanding what different partners, who they are, and what they are contributing in the space of CRVS strengthening. In Sri Lanka, still the tool enabled us, and which again we are replicating in a number of countries, to be able to understand, on the government side, they need to be able to understand, are the partner interventions addressing the gaps identified through the SCORE that was implemented. So SCORE, as we presented yesterday, was implemented in 2018, but also the most recent one was implemented last year. And it's a global assessment that we do as WHO. So within that, we also able to assess how the alignment of the partners with the national HIS and CRVS priorities. At times, as partners, we come in and support our own priorities, which at times, or most of the time, is not probably aligned with the national priorities. So through this tool, we're able to assess whether there's that level of alignment, and where the government should invest in terms of bridging the gaps that have been identified to achieve the national priorities. And also getting to know which regional or global partners in this space are supporting what aspects of the various goals or priorities of the government. But on the partner side, this tool can also provide an understanding in terms of how the investments that we put in place can have greater impact. At times, probably we come in and probably support siloed information systems, and probably at a very small scale, which might not yield enough impact. So this tool will be able to help us identify what critical gaps align with the national priorities can we invest in to maximize impact at country level. and also to appreciate in understanding of the capacity that exists, which require investment in at the country level. But then again, also to prevent the overlaps that we see in our various areas of work and the duplications, which leads to also wastage of resources. So through this, we are able to identify areas that we could synergize to avoid duplication, but also to maximize impact through the limited resources that we are able to mobilize. But then again, also aligning to the strategic plans that countries have developed, and also aligned with the regional priorities of the regions that we operate in. So basically that's what the tool does in a way, in terms of mapping the national health priorities and aligning us as partners in terms of those areas that I've outlined. So I was told this presentation was to be strictly 5 minutes. That's why we've kept it that brief. Thank you very much.
Thank you so much. I mean, this is very, very interesting. And yeah, I mean, we talk a lot about trying to coordinate and whatever, but ultimately it also comes down to country needs, right? And you really highlight that very well, and identifying country needs and the country's stakeholders really taking the lead in what is needed and which partners they want to work with and have to work with, right? So I'm really pleased that we have one of our national stakeholders here today who will present on the inter-ministerial coordination in Kenya. So we have Paul Mwangemi, who is the head of the Civil Registration Services in Kenya. We heard a little bit about Kenya already, but I'm sure you'll have very good insight. So thank you so much. And we don't have a PowerPoint, right?
It's okay. Thank you, madam, and thank you, my fellow panelists. I'm going to take a different approach. Mine is not a presentation, but it's actually a story that I'm going to give you as far as Kenya is concerned, because it's the practical aspect of it. If I may start with the background in terms of registration in Kenya, it started way back in 1904, and there was that way it was being done. But again, it became a compulsory affair by 1971 when we had a country. The expectations at that, since then in terms of our registration coverage, we are supposed to be at least 100% registration coverage, but it has never happened. And the biggest issue here was actually the aspect of coordination. How are we coordinating our work? Initially, we were actually doing this work together with marriages and divorce. It was actually birth, death, and marriages. And in terms of personnel and our spread in the country, it was actually not well spread in the country, so we did not have enough personnel to do that work. And that is where the rain started beating us. Now, fast forward, what happened was that when these events took place, it was actually the responsibility of the people affected. If it's the mother, it was the mother now to take that responsibility to do the reporting. And that way, in as much as these events were taking place, they were not being reported in time, and some of them actually could not be reported at all, so we were not getting the information. By 1984, we had actually the first coordination that came in place. We managed to get as a country a consultant from Israel who introduced a new system where, in as much as the parents were given the responsibility to do the reporting, but again, the institutions were actually given that responsibility again to make sure that they receive that information. So the forms were revised, and we actually managed to get that information. But again, it was not enough. Why? Because as a department, we did not have enough personnel to collect this information from the source. So a deliberate move was done in 1989 and 1990, where now this particular function was moved from the office of the Attorney General to the office of the President. Why? Because we wanted to make use of the officers on the ground. Because the office of the President, which is actually the Minister of Interior, have staff, the lowest government administrative officer on the ground, whom we call the Assistant Chief. They cover almost all the areas. So it was a deliberate move, and this responsibility of collecting this information was actually placed to them. This was actually to make sure that now all those events that take place, especially the community events, are actually collected, registered, and we get that information in time. At the same time, of course, we know these events take place in two places, either in the community or in the hospitals or health institution. A deliberate move was made to make sure that now we incorporate the Ministry of Health to make sure that all the events of birth and death taking place in the health institutions are also recorded and forwarded to our department. This way, actually, we wanted to make sure that now all those events taking place either at home or in hospital, we were actually able to get to them. So this is where actually that aspect of collaboration and coordination in Honest started. We had the Minister of Interior in one hand, we had the Minister of Health on the other hand collaborating with us to make sure that we get enough information. And I can assure you, when that one happened, the registration coverage actually started rising. But again, over and above that one, it was not enough because, you know, we have the data generators, but again, we have data users who are supposed to come in. For data users, quality is actually important to them. It's very, very essential. And as much as we're collecting that information, the issue of quality was again an issue, and we decided that now we bring in together partners who have the technical capacity to make sure that whatever information we have is actually analyzed and we come up with statistics that are reliable. We had to loop in the Kenya National Bureau of Statistics. Of course, initially it was the Central Bureau of Statistics as our stakeholder. That way, it was actually now not really easy, but it was able for us to be able to generate reports which are reliable for purposes of decision making. But now, over and above that one, in terms of resources again, because now issues are dynamic, and at some point we were thinking of now operationalizing, not really operationalizing, but actually computerizing operations for efficiency delivery of services. It needed some sort of capital investment. So what did we do? We had to incorporate more stakeholders into the whole system. And the best way to do that was actually to form what we call a national technical working group on civil registration, where we brought together various stakeholders, both from government and outside government, including our development partners. That way, we were actually able to get some assistance in terms of technical assistance and other resources, which, as we speak, and as a country, we have managed actually to make strides. Now, to come to the structure of our technical working group, or the governance structure, it's a sort of a two-tier, because we have the steering committee at the top, which comprises of the principal secretaries responsible for the various ministries and agencies, both from the producer and users of that information or data. And then down here, now we have the technical working group, which is now the technical and operational aspect of this governance structure. And in terms of these operations, we normally meet quarterly, but again, when need arises, we normally convene that meeting. And what has assisted us with that kind of governance structure is that we have a common vision of what needs to be done, because we have some of the stakeholders interested in actually producing data that is reliable. On the other hand, we have stakeholders who are now interested in making use of that data. And then we have enablers or facilitators, such as the Minister of ICT, because now we have to digitalize our systems. Also, we have stakeholders from government, like the Office of the Attorney General, because as we do that, we have to realign our operations with the legal framework. And of course, they are there also to make sure that they give us the legal advice and take into consideration what was not part of the legal framework regulating our work. That is exactly how the system has worked on us. And as I speak here, in fact, we moved from around 45% in terms of registration coverage. Right now, we are over 80%. In fact, at some point, we hit 86%, but again, it came down because of some other reasons. That was birth registration coverage. In terms of death registration coverage, we moved from around 30% to around 50%, and we are still moving ahead. And we believe with this kind of coordination and collaboration, we'll even do better. Now, it does not stop there, because now with reliable information, we have so many organizations and other agencies coming in for this particular information. We are automating our systems, and out of that one, we are going to have APIs that we're going to share with various stakeholders like the Ministry of Education and other stakeholders who are actually interested in this same information. It will be very easy now to share this information electronically for those users for purpose of verification and for them to offer their services depending, of course, on their operations. I think for now, let me stop there. But I believe whatever I have said is actually practical, because this is something that we have applied, we have done, and we have seen actually the impact of this particular coordination and collaboration. Thank you so much, and be blessed.
Wow, that was fantastic. Thank you so much. I mean, it's almost like a guidance to what to do. Thank you so much to doing, and also really explaining the practical steps. And what I really picked up on was there's a common vision, right? And you knew what you wanted to do. You all agreed on the common vision, have a very clear structure, and also the flexibility, right? If you need extra meetings, you will have extra meetings. And I also, as far as I understood, you also have increased the number of people you kind of involve over time. So yeah, thanks again. Thank you. Okay, that makes it very hard for our last speaker to follow, but sorry. So we do have our last speaker, and I do hope we have a little bit of time for questions and answers afterwards, because I'm sure there's lots of people who have questions to these excellent speakers. The last presentation will be from Zambia. This is about aligning the legal framework, systems, processes, and data, insights from CRVS and ID management coordination in Zambia. And we have Mr. Kennedy Chisumba, and he's the Deputy Registrar General from the Ministry of Home Affairs in Zambia. So I think you don't have to move the microphone up or down. Over to you. Sorry. You okay there?
Can you see me? My colleagues earlier were asking that question each time they came to the podium. So I want to just confirm, are you able to see me? I'm visible? All right, thank you. Okay, I'm going to present on CRVS legal framework, the system, the processes, and the data aligning to ID in Zambia. So Zambia has a population of about 20.6 million people, and it reflects a steady growth of a high birth rate. The gender distribution is nearly balanced, estimated at 10.2 males and 10.4 females. Okay, that's the demographic highlights. Please go on. So the key features of our civil registration in Zambia, it aims to be continuous, permanent, compulsory, and universal, ensuring that every vital event is recorded. The administrative authority is the Department of National Registration, Passport and Citizenship under the Ministry of Home Affairs and Internal Security. This is the department that is mandated to manage the civil registration and vital statistics in the country. So we have the types of registration there, And this includes the birth and death, the marriages, the adoption, and national registration, which culminates into the national ID. We are alive to the fact that there are a lot of benefits in civil registration. Good governance, human rights, and digital integration are some of them. And the reforms and modernization initiatives that have been done include digital transformation. Zambia is implementing online platforms for civil registration and vital statistics, and national identification to enhance data capture and service delivery. Plans are underway to develop a comprehensive electronic civil register integrated with the national ID system through the Integrated National Registration Information System. So at the moment, Zambia has implemented the Integrated National Registration Information System, which has the birth module, the death module, as well as the ID module. This system does not have the marriage module. It's yet to be included in that system. So currently we have a situation where we have the legacy system still running side by side with the digital system. We haven't yet started issuing the digital IDs, but we are in the process. We are at the point of issuing the IDs. What we are doing now is just harvesting biometrics from the citizens and populating our civil register. So key laws and policies governing vital registration, these include the Birth and Death Registration Act, Cap 51, the Marriage Act, Cap 50, Children's Code. This is a code that has brought together all laws, consolidating them into one piece of legislation that is pertaining to child protection. So initially we had various pieces of legislation that were trying to protect children, but this time around we have a code that has brought together all the pieces of legislation into one law. We also have the national CRVS policy, which is a guide into what we need to do. It has the vision for CRVS in Zambia. So complementary strategies such as the National Health Strategic Plan and National Development Plan have provided an enabling environment for the system growth. Okay. I won't dwell much on the historical background because we know that civil registration in Zambia dates back to the colonial era in 1898 or before that. And we have this act on birth and death that was made compulsory in 1973 on 14th March. And that means that all birth that occurred from 1973 to date must be registered by law, and we must ensure that every death occurring in the country equally must be registered. Marriage registration, we have a dual system as well. Customary marriages, which are handled by the local courts, and the Ministry of Justice, statutory marriages administered by Department of National Registration and the municipal councils. So marriage, we realize that marriage registration is critical for women, women's inheritance right and protection against child marriage and economic exclusion. Just like my colleague from Zambia, Mabel Mungomba, mentioned earlier in her presentation. National registration IDs, this one is managed by the Department of National Registration, Passport and Citizenship. It's a parallel system because we still have the legacy system running. And on the other hand, we also have the digital system running, which I earlier mentioned as the INRIS, the Integrated National Registration System. We haven't yet started printing the digital cards, so they're running side by side. On the supply side, we have quite a number of barriers, despite these beautiful laws that we have, good legal framework, but registration is still very low. This is because on the supply side, the system downtown, frequent system downtown, and poor internet connectivity makes it difficult to register. So whenever the system is down because of internet in the districts, then it means that the registration officers will not be able to conduct civil registration. Inadequate materials, of course, due to limited resources. Coordination between Home Affairs and Health, Ministry of Health is a bit weak. We have entered into an MOU so that we could do registration at health facilities. Initially this would work, but later on we discovered that each time the health workers and caregivers that were trained moved on transfer, then we had to start all over again. So it's a challenge. Yeah. We have issues of vendor locking in the system and costly system updates. So our system has a challenge. We need to work on this. We are trying to go into an open source, open standards, so that we could beat this challenge. The limited skilled personnel for death certification and verbal autopsy is also a challenge. This is because coding of cause of death is centrally done in the capital. So meaning death registration that is occurring in the district offices has to be reported to our headquarters, and our coders will have to code the code of death according to the ICD, and later on revert back, and then that's when a certificate can be issued. So this takes a bit of time, and yeah. On the demand side, long distances to the registration centers because they are centralized to the district offices. The awareness and these cultural norms and patriarchal norms limit women's participation in registration. Financial constraints to travel to the registration centers too. So.
That wasn't me.
Oh, wasn't you? Okay. Analyze groups, especially the a government network, which we are trying to deploy to all the districts so that we're able to get rid of this challenge of network. We are digitalizing and archiving legacy records, because this is a process eventually where we have to finally become fully digital. But we are not forgetting the millions of records that are still paper-based. We cannot just start afresh, so what we have decided is to have the paper-based records digitalized, because there will be a reference, they are a reference point each time we are doing the digital biometrics and registration. Training programs for health personnel, like I mentioned, in the health facility we have a challenge whenever the trained personnel are transferred. So what we have done is to come up with a continuous training program for everyone, not just a specific group. Then on vendor locking, we are moving to an open source system to just beat this challenge, which we feel is going to be cheaper for us and is going to be manageable. Awareness on legal reforms, public sensitization during the Civil Registration Week has proved to be very helpful in terms of awareness raising campaigns. It has worked for us. We just came out from one, the Civil Registration Week, and that helped us to raise awareness with our partners, UNFPA, UNICEF, and the others. We want to amend the outdated laws to support digitalization and interoperability. We want to review our memorandum of understanding with the various institutions that support CRVS. I should be winding up now. We have opportunities for inclusive CRVS and national ID system to achieve inclusive and universal registration by 2030. Zambia is leveraging several opportunities. These include decentralization and partnerships. The expansion of registration service to health facility and sub-national centers. So within a particular district, what we have done is to open up sub-centers so that we can take the services closer to the doorsteps of the people. Strengthened collaboration. We intend to review our MOU so that we strengthen this collaboration, and also intend to enter into other MOUs with other stakeholders, other ministries like Ministry of Justice and Ministry of Local Government. The digital transformation, we want to fully roll it out to all the districts for interoperability with health and social systems. We want to integrate with the refugee registration system. This is called Progress V4. We want to bring it into the integrated national registration system. The legal policies reviews, we want to do a review and harmonize CRVS related laws to include customary marriages and divorces as well. Currently, statistics on marriages and divorces is fragmented because the institutions are working in silos. The local government, the local courts have their own registers for marriage and divorce, and we have our own registers for statutory marriages. So we are in silos. We are hoping these laws will bring us together. So we want to implement also the National Civil Registration Policy to promote universal coverage. Capacity development, inclusion of death certification training in medical curricula, because we realize this is very important. Then expansion of double autopsy programs and data collection tools which are aligned with UN standards. Zambia's commitment to improving its civil registration and vital statistics and national ID systems is evident through the ongoing reforms, digitalization, and decentralization efforts. However, gender disparities, cultural barriers, and access limitations persist. By strengthening coordination, investing in technology, and addressing social-cultural challenges, Zambia can build an inclusive, gender-responsive, and digital integration CRVS system that supports good governance and equitable access to ID and services for all citizens. I thank you.
Now I have to move the microphone. Thank you so much. That was really, really insightful, and I really appreciated your honesty about the issues and the challenges you're facing, and also that coordination takes time, right? It doesn't just happen the first trial. I also think you face some very particular issues with refugee populations and so on. I really appreciate you being sharing about those issues as well. So another round of applause for this excellent presentation. And I have been told that we have 6 minutes for Q&A. It's not a lot, but it's better than nothing. So I'm sure there's lots of burning questions. Please raise your hand if there's any questions you have for these excellent speakers. I have a ton of questions, but I will let you guys ask the questions. Any hands? Anyone? Seriously? None? Really? Okay, there's a hand there. Okay, great. If you could just introduce yourself, that would be wonderful. Thank you.
Thank you very much. My name is Klosi Jamemia from Ivory Coast. I'm from the Ministry of Women, Family and Child Affairs. I want to thank all the panelists for their brilliant and rich presentations. I want to direct my question to the presenter from Indonesia. You gave us very rich data. I want her to share with us their experience in the successes of registering deaths. I noted that you are at about more than 80% in registering deaths. So I want to know how you were able to get there, because often African countries face that challenge, especially sub-Saharan Africans, countries. So what are some of the strategies that you took, for instance, to reach the rural populations to be able to get to those brilliant results? Thank you.
I don't know how much you heard of that, Vinayda, but it was a question from Ivory Coast on how you have managed to get to 80% death registration completeness, because there's a lot of, I think, slight jealousy around the room, because that is a very, very impressive feat. And of course, in a country like Indonesia, you also have, very remote areas, hard to reach areas, remote islands, and so on. And I think that was a particular question, like how do you actually reach the rural population? Are you okay to respond, Vinayda?
Just to make sure, is it regarding the vital events or the
death registration? How you've managed to get to death registration completeness, such high death registration completeness? Are you okay?
Yeah.
Yeah, great, thank you.
So actually, thank you for the questions. The death registration, I think it wasn't like 80%. It's not 80%. So it's by the end of the 5th year after the occurrence, still like less than 60% of the death registration. The highest percentage happened during the COVID pandemic. So actually, we have also identify this as a good practice during the process of production our reports, that we found out that that in 2021 the death that occurred in 2021 has been registered almost 90% by 2023. So it's very, very huge progress. But because during the COVID, there is like innovation for people for registering their death, because all the people who are died during the pandemic need to report their death so that they can get allocation to bury the families. And also, all people at that time has, so the government designated the application to follow people. So that application is mandatory for people to travel. So everyone who travel need to install the application, and also they need to apply to get the vaccine. So almost everyone are there. So once they dead, they will record it in the system. That's a good practice, but unfortunately, it wasn't continued after the pandemic is over. I think, that's a pity. I hope this answer your question.
Thank you. So,
my friend from Indonesia also want to add, maybe.
Yeah, Vida?
Just quick clarification, because I think we need that cited our report. So it's not 84% the registration, but 84% death happen at home, and only 2% of it's registered. The event is just registered. So just to clarify that, thanks.
Thank you. But I think what was really great about your response, Vinita, was also you really highlighted how COVID made you having to rapidly change your procedures, and how that actually have had positive impact. It's a bit pity the numbers have gone down again, but there was definitely lessons learned. And I think we saw in many countries the linkages between the national ID, vaccination, restrictions of movements and so on. It kind of changed the whole discourse around CRVS and the importance of CRVS, both for death registration and birth registration, also for the national ID. So thank you for that question, and you can probably have a longer chat with Vinita over lunch. I think we have one last question. Okay, just because you broke your hand, Nick, I'm going to give the last question to you. Over to Nick.
Thank you very much, Tanya. This one's not broken, it's this one. Excellent presentations. Just a reflection and a question regarding the Health Data Collaborative presentation. I think it's excellent to see all these great country examples of, what's been done, and how complicated coordination can be. Personally speaking, I was in Nepal during the mission of Health Data Collaborative and SDG3 GAP mission about 2 years ago. And one of the reflections really I had was, how useful it was, but how difficult it is to maintain momentum going forward. And I just wondered if you had any sort of reflections and ideas of, the best ways to achieve that, given, that we really need continuity and coordination going forward. So thank you.
Thank you very much, Nick. I think that's a perfect final question. How do we maintain momentum? Over to you. It's a difficult question.
It's a difficult question, but also an easy question for reflection. And just going back to your question, personally also I've made that observation. And for a long time when we started the initiative of the Health Data Collaborative. And I think, I'm sorry to say, but the challenge is also with us as partners. Many a times we come together, make commitments, rally ourselves, but then in terms of coming out strongly to own and implement what we have agreed on becomes a bit of a challenge, I'm sorry to say. Because we've had global great events where the HDC convenes various stakeholders together, and quite a lot of commitment comes into force and agreements in terms of what we need to do even in countries. But then even when we come down to country level, consolidating ourselves to be able to go as per what we've agreed on in terms of our alignment becomes a bit of a challenge. And the challenge we find ourselves in as WHO is we don't have enforcement power. We can only convene. So we need the goodwill of the partners and the stakeholders, as well as even the donors, so that whatever we've agreed on at, say, global level is best translated when we go to work in countries. And then again, HDC is trying to do a lot in terms of monitoring the progress we are making. And I think it is at that point that if there are any challenges in terms of implementing what we have agreed on at all global levels, at the country level, then we should be able to highlight and be able to draw the lessons that we may need to rectify in terms of just trying to perfect our work. So when it comes down to the country level, I think our engagement with the national health authorities also differs. And so, just like an example which was given by Dr. Paul Mwangemi, in terms of coordination, what we have seen work for Kenya for quite some time is having a coordination mechanism at country level, which is aligned with the global level, makes it easy to translate what we've agreed on in terms of their alignment to national priorities through the inter-country coordination mechanisms, such as like what we have as the national CRVS technical working group. But previously, within the health sector, we used to have interagency coordination mechanisms, which will bring all of us as partners together. And in that, we will basically be rallying the call in terms of what we have all agreed on in terms of how do we better support countries' national priorities. So that would be my take, but then feel free to have better discussions with me and the rest of the other colleagues. Thank you.
Thank you so much. And I think, I mean, there's coordination at the global, the regional, the national level. In my personal opinion, in the end of the day, a lot of it comes down to relationships and building strong relationships with as many people as possible, really. And we have a great opportunity to build relationships now because we're going into lunch. We're only slightly behind schedule. We are supposed to be back at 2:45, so you have an hour. When we come back, we will go out to 3 different rooms again. I have been told that there will be a slide showing you where the different groups are, so I'm waiting for the slide. For session 8, so you have to be back at 2:45 and you go directly to the rooms that will be shown on stage. And you will need a voucher for lunch, and you will get that at the registration desk downstairs. And lunch will be served at the same place as yesterday. No, it will not be served as the same place. Okay, I'm being told it's being served somewhere else. Can you take the floor, please?
All right, first of all, let's appreciate the amazing panelists and the moderator. Thank you. So thank you so much. Please note the topic and the room you're going to. Then secondly, lunch is at Cafe Kigwa, which is near, right before crossing over to the Nyamachoma place. So you'll be able to see that. We'll be having staff from the hotel guide us. Yes, so we'll be back here at exactly 4 p.m. So immediately after lunch, pick your meal, as you go down the stairs, pick your meal card, go for lunch at 2:45 sharp. Make sure that you're in the room that you want to be in, and we'll reunite here back at 4 p.m. sharp on the dot. Thank you so much. Have a lovely lunch.